welcome back to the deep dive. You sent us a truly monolithic stack of sources today. I mean, hundreds and hundreds of pages,
It was quite a bit, yeah.
covering everything from global insurance structures to really specific national tax codes. But it all revolves around one central concept: your total compensation package.
That's right. For so many people, the salary negotiation, that feels like the end of the conversation. But in reality, that cash figure is only the beginning.
Yeah.
Today, we are diving into the complex and, let's be honest, often opaque world of employee benefits. They go by a lot of names: benefits in kind, perquisites, or the classic one, fringe benefits.
So our mission today is to rapidly dissect this entire universe of non-wage compensation. We need to cut through all that complexity and give you a really crystal clear framework so you can understand the economic value of what your employer offers you, why they're offering it, and how dramatically those structures change depending on, well, where you live, whether you're working in Vancouver or Manchester or Memphis.
And this deep dive is just so necessary because benefits are incredibly complex, they're global, and they're highly technical. So we'll be synthesizing these, really dense definitions, comparing major national models.
And most importantly,
Pulling out the most actionable insights so you can actually assess your own package and understand where your money and your risk actually lies.
okay, let's unpack this immediately. I want to start by defining the core mechanism that really underlies so much of the benefits market. It's called salary packaging or salary exchange.
Right. This is the fundamental trade-off. It's when you, as the employee, agree to trade a portion of your cash wages for a non-cash benefit.
So your gross salary, the number on your contract, it actually goes down.
Goes down. But you receive an equivalent or often, a greater non-monetary value in return.
And the motivation, the reason to do that swap for both the employer and the employee, it's almost universally tax advantage, isn't it?
Absolutely. If the benefit you receive is non-taxable, or if the contribution you make is tax-deferred, you effectively get more value than if you just took the cash and then paid for that same item yourself after taxes were deducted.
It's a more efficient way to get the same thing.
Much more efficient.
Yeah.
Now, let's look at this through two different lenses, because management and employees, they see benefits in fundamentally different ways.
Okay.
From a managerial perspective, so the people running the HR and reward budgets benefits are calculated as indirect expenses. They are strategically designed for three things: to attract, retain, and motivate staff. That's the mantra.
But the employee experience is, it's polarized. We immediately differentiate between what we feel we are entitled to and what feels like a bonus.
Yes. The sources really nail this distinction. On one side, you have mandated benefits. These are the ones required by local or national law. They create rights and entitlements, things like statutory vacation time in most countries.
The things you just expect to be there.
They have to be there. And then you have the discretionary benefits. These are the extras. They are intended to inspire loyalty, job satisfaction, but they are subject to management whims and, the company's financial tides.
They are the golden handcuffs that keep you happy.
That's a great way to put it. And understanding which category a benefit falls into. That's really the first step in judging its stability and its true value to you.
That distinction, the legally required safety net versus the shiny retention tool, is just absolutely crucial for the modern employee. So let's use that framework as we map out the landscape of non-wage compensation in Section 1.
So let's ask the foundational question. Why do corporations spend billions, truly billions of dollars on non-wage compensation instead of just, increasing salaries? You mentioned attraction, retention, and motivation, but what is the core economic engine driving all this?
Well, you're right. It's not charity. The primary goal from the organization's perspective is really dual-pronged. First, yes, it's to increase the economic security of the staff.
That makes sense. People with good health insurance and a solid retirement plan are, they're less stressed, they're more productive. It's the human element.
Right, the human element.
Exactly. But the second and arguably more strategic goal for the company's bottom line is to dramatically improve worker retention across the entire organization.
Because high turnover is just enormously costly.
It's a killer. You have recruitment costs, training costs, lost institutional knowledge. I mean, the list goes on. Benefits that vest over time or benefits that are really complex and expensive to replicate somewhere else, they anchor employees to the company.
So this whole strategic effort, this discipline, has a name.
It does. It's what we call reward management.
And when we look at the comprehensive list of these traditional benefits, the ones that form the bedrock of total compensation, They really are designed to cover major life risks and long-term planning, aren't they?
They absolutely are. They hit every critical pillar of a secure life. We're talking about comprehensive group insurance, so that includes your health, your dental, vision, life insurance.
Dispensability.
And disability income protection, which is so crucial. That's the insurance that replaces your wages if you literally can't work. Then, of course, you have retirement benefits, whether they're defined benefit or, more commonly now, defined contribution plans, like a 401k.
And then there are the ones that support personal growth and stability. Things like tuition reimbursement, which encourages your staff to upskill on the company's dime.
Generous sick leave and vacation policies, and even very specific high-value items that are becoming more common, like employer student loan contribution.
Which is a huge one for younger workers.
Massive. Or long service leave, which you see in places like Australia and New Zealand.
And for senior staff or highly specialized roles, it can get very domestic, can't it? The sources mention housing.
Oh, absolutely. Housing assistance is a major one. It might include furnished accommodations, maybe with or without utilities paid for. These elements, like housing, are serious economic pillars. They completely change an individual's personal balance sheet.
But then we get to the fun stuff. The things that are almost universally discretionary, which we all just call perks or perquisites.
Right.
These are the benefits that often don't represent massive economic security, but they do represent massive lifestyle improvement.
These perks are, colloquially defined as benefits of a more discretionary nature. And they're often given based on performance or seniority or just your general status within the company.
So they act as visible indicators.
Exactly. Of where you stand in the hierarchy or how valued you are.
So give us some of the classic high-status examples from the material.
Well, the archetypal example is the take-home vehicle, the company car.
Of course.
It signals status, and it saves the employee a huge personal expense. Then you have allowances for things like stationery or lunch, which are minor in the grand scheme, but they just add that daily convenience.
Free, high-quality refreshments in the office.
Yeah.
It's now so common, it's almost an expectation, but it definitely started as a perk.
It did. And it extends beyond just, material goods. The sources included some really fascinating non-monetary perks.
Like what?
Well, think about leisure activities on work time. Team building events that happen to incorporate, say, golf or spa treatments.
Right.
But perhaps the most valuable low-cost perks involve control and autonomy. Getting first choice of job assignments or preferential vacation scheduling.
That's a big one.
It's huge. Or even being given first refusal on promotions when internal vacancies come up.
That's a really important point for you, the listener. A perk doesn't have to cost the company hundreds of thousands of dollars to be immensely valuable. Control over your time or your career path is often worth so much more than a subsidized gym membership.
Exactly. The cost to the company is marginal, but the value to the employee's quality of life and their career trajectory is just enormous.
Now, we keep using this specific, slightly archaic term, fringe benefits. It sounds like something pulled right out of a historical document. Why was that specific phrase coined? Where did it come from?
That's a fantastic question. We often use the phrase without really thinking about it, but the origin is rooted in a regulatory crisis in the United States.
Okay.
The term was coined by the War Labor Board during a very specific historical period, World War II.
Right. So the U.S. economy was operating under heavy restrictions during the war. What restrictions specifically forced companies to, invent this concept?
The critical hurdle was that direct wage increases were largely prohibited, or at least they were heavily restricted by federal regulation. The government had to control inflation during wartime, and clamping down on cash salaries was a key mechanism for doing that.
So employers couldn't just throw more money at the labor shortage to attract and retain workers.
Precisely. Industry still needed to attract and, more importantly, retain labor in a highly competitive market, especially with so many men being called up for service. So they had to find a way to circumvent the wage freeze.
And this was it.
This was it. The War Labor Board created the term fringe benefits to categorize all that indirect compensation, things like health coverage, better housing, better pensions, that were real costs to the company but did not violate the base salary caps.
That is where it gets really interesting.
Yeah.
It contextualizes the entire benefit structure we have today. The very concept of the fringe benefit is essentially a regulatory workaround.
Yes.
It was born out of a moment when the free market for cash compensation was being artificially suppressed.
It shows that benefits are not just a simple financial calculation. They are a strategic response to external pressures, whether those are market demands or, in this case, government regulations. Companies got creative and realized they could bundle security and lifestyle upgrades instead of just cash, and that tradition just, it stuck.
So now that we know why benefits exist, let's look at how they function globally, because the moment you cross a border, the foundation of your total compensation just shifts dramatically.
Oh, completely. And it's driven almost entirely by the national approach to healthcare and mandated social programs.
This is where that distinction we made earlier between mandated and discretionary benefits becomes absolutely visible. It dictates the entire structure of what an employer even needs to offer.
Right. Let's start with Canada, which provides an excellent example of what we can call a top-up model.
In Canada, the foundational health coverage is already provided by the provincial government through taxes. So the benefits sponsored by an employer, the life, disability, health, and dental plans, they are almost universally a top-up to that existing provincial coverage.
And the key operational detail there is that the employer plan coordinates with the provincial plan. You have to utilize the provincial coverage first for whatever it covers.
So what are these Canadian employer benefits actually paying for then?
They're filling critical gaps, or they're providing an enhanced level of security that the public system doesn't cover. This includes the big-ticket insurance items, life and accidental death and dismemberment, and that all-important disability income protection. Then you get coverage for, let's call them comforts or specialized services, things like hospital room upgrades. So a semi-private or private room instead of the standard ward.
And travel medical insurance, which is critical.
Absolutely critical, since provincial plans often don't cover you adequately outside the country. And then most commonly, the plan covers things like registered therapists or practitioners, chiropractors, physiotherapists, massage therapists, prescription drugs that might not be on the provincial formulary, and vision care.
And dental is a big one.
Dental is huge, and it's also highly structured. You'll see plans broken down into basic, which is preventative care and fillings, major, which is crowns, bridges, dentures, and then orthodontics.
And beyond the healthcare, what about the financial incentives in Canada?
The most popular are group RRSPs, that's registered retirement savings plans, and group profit-sharing plans. They're structured to offer tax advantages and growth potential that are often superior to what an individual could access on their own.
Now, let's sharply contrast that approach with the U.S. benefits basket. In the U.S., the employer is often the primary vehicle for providing the foundational health insurance. That makes it a much higher stakes calculation for both the company and the employee.
A completely different starting point. And aside from managing that central health risk, U.S. employers offer a huge array of tools that help you manage the tax liability for care.
Right. We see things like flexible spending accounts, FSAs, for both health and dependent care.
Where you can put pre-tax money aside for eligible expenses. You'll also see things like relocation assistance, which can be a very significant benefit.
The benefits package often extends into security for later life as well, like long-term care insurance.
Yes, or even legal assistance plans or adoption assistance. It's a vast, vast landscape.
I want to circle back to the discretionary element here, though. The source material really highlighted a strong U.S. focus on lifestyle perks aimed specifically at corporate loyalty.
That's a real cultural differentiator. Formal or informal employee discount programs for theme park tickets, movie vouchers, hotel bookings, gym memberships, they're extremely common.
And they don't really change your bottom line in the way a 401k match does.
Not at all, but they are explicit efforts to raise employee satisfaction and foster a sense of loyalty that goes beyond just the base salary figure. It's about the employee experience.
But here is the critical absence in the U.S. system that remains a true outlier internationally: mandatory paid time off, or PTO.
It is the piece of critical context that always surprises global listeners.
It's shocking, really.
Federal or state law in the United States does not require employers to provide paid vacation or paid sick days. It remains technically a discretionary benefit.
But the reality is that the market demands it, right?
Yeah.
No competitive company could get away with offering 0 vacation days.
Exactly. The market pressure is so strong that the sources show 86% of large business workers and 69% of small business workers do receive paid vacation days.
So what does that tell us?
It indicates that while the U.S. lacks the legal mandate found in nearly every other industrialized nation, employers are forced to offer it as a retention tool just to remain competitive.
So what's a mandated legal entitlement almost everywhere else is a discretionary but still essential perk in the U.S.
That's a perfect summary.
Okay, let's move to the UK now, which gives us perhaps the most structured and clearly categorized approach to compensation I've ever seen.
The UK system is very neat. It organizes benefits into 3 distinct categories, which is highly instructive because it dictates how the benefits are funded and how you, the employee, can access them.
So, category 1.
First, you have core benefits. These are mandatory for all staff, and generally you can't remove them. They are the absolute essentials. Pension contributions, life insurance, income protection, and statutory paid holiday. These are the non-negotiables.
Then number 2.
Second, you have flexible benefits, which are often part of what's called a flex scheme. Here, the employer sets aside a budget, and the employee gets to choose how to allocate a proportion of their pay toward specific benefits they actually want.
So it's customizable.
Highly customizable, and this system is growing incredibly rapidly as employees demand that kind of choice. A 2012 survey indicated that 62% of employers already offered one.
And the third category.
And third are the voluntary benefits. With these, employees opt in and they pay for them personally, but the employer provides the access and, critically, often structures them via the incredible important salary sacrifice mechanism.
Okay, salary sacrifice. We mentioned this earlier, but let's go into detail because it seems to be a key piece of the UK compensation puzzle.
It is the genius element here. The employee voluntarily gives up the right to part of their cash salary, which effectively reduces their gross salary on paper, in exchange for the employer providing a non-cash benefit of a similar value.
So if I give up, say, £100 of my monthly salary, my employer then buys me a non-cash benefit worth £100. Why is that an advantageous trade?
Because both you and your employer save on tax and, crucially, on national insurance contributions on that £100. If the benefit is tax-exempt, you, the employee, receive the full £100 of value tax-free.
Which is a net gain compared to buying it with my post-tax income.
A significant net gain. And this mechanism is so powerful that the savings generated often fund the flexible benefit scheme itself. Common examples you see are the popular Cycle to Work scheme, extra pension contributions, and child care vouchers.
It's fascinating. So Canada sees benefits as insurance coordination. The U.S. sees them as tax shelters and primary health provision. And the U.K. sees them as these structured, tax-optimized categories built around a salary exchange mechanism. The geography really does dictate the financial framework. The moment a company gets large or starts operating internationally and managing this patchwork of core, flex, voluntary, mandated discretionary benefits, it must become an absolute administrative nightmare.
It does, which leads us directly into Section 3, the outsourcing and localization of perks.
So companies just hand it off.
Many do. For simplicity, for compliance, and honestly, to offer a breadth of choice that would be impossible to build internally, many employers outsource their benefits administration to third-party providers.
And these providers are no longer just, boring back-office administrators. They're full-on engagement platforms now.
That's right. The sources highlight that they still manage the core functions, enrollment, and claims, but they also offer this huge suite of services, retail discounts, mental well-being resources, employee assistance programs, or EAPs, and virtual healthcare services.
They're essentially the digital storefront for your entire compensation package.
A perfect analogy. And we've seen several major players mentioned repeatedly in the sources, which demonstrates the scope of this global infrastructure. You have Perkbox, which is UK-based, offering something like 9,000 retail discounts and a 247 EAP. Then there's Reward Gateway, which was cited as a global platform that integrates perks with a company's internal communications and analytics. So it makes the benefit package part of the company's daily dialogue.
And what was the third one?
And finally, Benify. Their focus is specifically on flexible remuneration and managing those complex salary sacrifice schemes across multiple international markets.
So these platforms are not just consolidating existing perks. It sounds like they are fundamentally changing what a perk even looks like.
They are, and that's leading to a new and I think crucial divide in the market, national versus local perks.
This sounds like a direct response to the massive societal shift toward remote and hybrid working models.
It is 100%. National perks are the established bundles. The discounts negotiated with major travel companies, national retail chains, big fitness franchises. They're scalable, they're convenient, and they're available to everyone in the country.
But the new trend, the more interesting trend, is the rise of local perks.
Right. These are custom curated to reflect specific, often smaller, local communities. And they intentionally involve independent businesses. So the local cafe on your corner, the independent barbershop, the boutique retailer in a suburban town center.
And this isn't just a feel-good HR initiative, is it? There's a strategic rationale behind this.
There is. Research suggests that personalized, locally relevant perks significantly improve employee engagement compared to those generic national offerings. When your perk is tied to a place you actually visit every day, you feel seen and valued by your employer in a different way.
It also strengthens community ties, which is a nice win for corporate social responsibility.
Yeah,
But more importantly, it solves a real HR problem,
it is.
the remote worker feeling left out problem. If you live 50 miles from the main office, a massive discount on a city center restaurant is completely useless to you. But a discount at your local dry cleaner or the coffee shop across the street, that's high value.
It connects the compensation back to the employee's direct daily life and the specific region they inhabit. And that's crucial for fostering a sense of belonging when they no longer have a physical office to go to 5 days a week.
So we have this sophisticated ecosystem of benefits, and it's growing in complexity and customization. But what happens when the economy turns sour and the company has to suddenly cut costs? Does all that sophisticated loyalty just vanish?
That is the central instability of the discretionary benefits model. And it leads us to a term that was coined in 2023 that perfectly encapsulates this risk: the Perk-cession.
A portmanteau of perk and recession.
Exactly. This is the phenomenon of the informal reduction, or sometimes the outright cessation, of those costly employee benefits and workplace amenities when companies face financial hardship and pivot ruthlessly toward efficiency and cost control.
So think about the symbolic cuts.
Yes. It's removing the gourmet free lunches, downsizing the fully stocked kitchen to just basic coffee and tea,
Canceling the expensive subscription to the corporate gym.
or dramatically cutting the travel budget that allowed for those fun team social events.
These are often viewed as soft costs, right? Easy things to trim for the budget without affecting the core business. But the consequences, according to the source material, are profound and immediate.
They are. These cuts, even if they are financially minor, are met with a swift, deep, and negative impact on employee morale and company culture. And the reason is fascinating.
Why?
Because what started as a discretionary incentive, a golden handcuff, was quickly internalized by the employees as an expected entitlement.
And when you take away something someone feels entitled to, you signal instability and, frankly, disrespect.
Exactly. The psychological contract is broken. And the material suggests that these actions can quickly lead to significant turnover, which sometimes exacerbates the very financial hardship the company was trying to solve in the first place by driving up recruitment costs.
So the Perk-cession is that brutal moment the employee realizes their sense of stability was, in fact, built on sand. That transition from a discretionary perk to a harsh economic reality forces us to confront the unavoidable role of the government in compensation. So let's shift gears and dive into Section 4, benefits and the taxman. Because the tax treatment dictates the ultimate value of every single benefit we've discussed so far.
The tax treatment is everything. It's the primary financial driver. For instance, in several countries across the globe, Australia, New Zealand, and Pakistan are good examples. Fringe benefits are subject to a specific fringe benefits tax, or FBT.
And that's a tax on the employer, not the employee.
Correct. It's a tax levied on the employer for the act of providing the benefit, rather than taxing the employee directly on the value they received. This contrasts snarkily with a country like India, which chose to abolish its FBT entirely back in 2009.
But in the U.S., the general structuring of benefits is actually hugely advantageous for both parties, provided you stick to the rules.
It's a core incentive built right into the U.S. tax code. Normally, employer-provided benefits are structured to be tax-deductible to the employer, so they reduce the company's taxable income, and critically non-taxable to the employee.
So you receive the full value of the benefit without paying income tax on it. That is a massive transfer of wealth outside of your normal tax liability.
It is, and we see clear examples of benefits that are explicitly excluded from your gross income. This includes things like accident and health plans and a portion of group term life insurance. Specifically, coverage up to $50,000 is typically non-taxable.
And many of the most valuable compensation tools function as crucial tax shelters. Right. They defer your tax liability on contributions or investment growth.
We're talking about flexible spending accounts, FSAs, and of course retirement plans like the 401k or the 403b for nonprofits.
Okay, here's a piece of jargon we need to clarify for the listener. FICA tax. We know contributions to a 401k are typically exempt from income tax, but what about FICA?
That's the subtlety, and it's an important one. FICA stands for the Federal Insurance Contributions Act. It's the tax that funds Social Security and Medicare.
Yes.
So while your contributions to a 401k or a 403b are exempt from federal and state income taxes, they are generally still subject to FICA tax. You are still paying into Social Security and Medicare on that contribution.
But health insurance premiums are different.
Right. Health insurance premiums that are deducted pre-tax are often exempt from FICA as well. That is a key financial difference and a slightly bigger tax advantage.
But I want to spend a moment on one of the most specific and, frankly, fascinating exclusions in the tax code. The in-kind exclusions, which is known as the meals and lodging rule. It's Section 119A of the U.S. tax code.
This is a perfect example of how hyper-specific regulations are designed to support real-world operational needs. So, employer-provided meals and lodging are excluded from the employee's gross income, meaning they aren't taxed, if and only if three very strict conditions are met.
What are they?
The item must be furnished by the employer, it must be provided for the convenience of the employer, and it must be provided on the business premises.
So if you're a ranch hand or maybe a hospital resident who is required to live on site for emergency reasons.
Exactly. Or if the company provides dinner because you are required to work through the night to complete a critical project, that value is not taxed as income. The key phrase that unlocks the benefit is for the convenience of the employer.
And the sources are very explicit about the caveat here.
Very explicit. Cash allowances for meals or lodging, even if they're meant to cover that same purpose, are included in your gross income and are therefore taxable. It must be provided in kind, the actual meal or the actual room.
We also have a very modern and unfortunately highly relevant tax advantage built around disaster relief.
Yes. Qualified disaster relief payments, so money paid out for necessary personal, family, living, or funeral expenses incurred because of a national disaster, are treated as non-taxable income to the employee.
That's a crucial safety net for people dealing with the immediate aftermath of, floods, fires, hurricanes that have been declared national disasters.
It is. But there's a necessary boundary here. The replacement of lost income or lost wages is not eligible for this non-taxable status. The payment has to be for expenses you incurred, not simply to replace a lost paycheck.
Okay, shifting back across the Atlantic, we noted the power of the UK salary sacrifice schemes, which save on both tax and national insurance contributions. But we have to address the potential long-term disadvantage for the employee.
This is a classic example of a short-term gain creating a potential long-term risk.
How so?
Because the salary exchange reduces your overall gross salary, it also results in you paying reduced national insurance contributions. While that means lower deductions from your paycheck today, those contributions are what fund your future government entitlements.
So you could be shortchanging your future self.
Potentially.
Yeah.
Reducing them may ultimately reduce your state benefits down the line, and the sources specifically point out that it could impact the state's second pension.
It forces you, the listener, to conduct a comprehensive lifetime value analysis on your own compensation. Does the immediate tax saving today outweigh a potentially smaller public pension 30 years from now? Understanding the FICA or the national insurance implications is just as important as the cash value of the benefit itself. We've established that health insurance is often the most expensive, most complex, and certainly in the U.S. context, the most critical part of the entire compensation package. So let's dedicate Section 5 to a deep dive into the specific mechanics and the terminology that you, as the insured person, absolutely need to understand.
Yes. Let's start with the absolute basics. Health insurance, at its core, is a contract where risk is shared among many individuals in a risk pool. This leads to a routine finance structure, either a premium you pay or a payroll tax the government collects.
And that contract covers all or part of the risk of you incurring medical expenses.
Right. And when we look at private insurance, which, as you said, dominates the U.S. and features heavily as a top-up globally, the financial costs are transferred to you, the patient, via some very specific mechanisms. Let's tackle the four main terms you will see on every single plan document.
Okay, first up.
First is the premium. This is the non-negotiable cost just to have the coverage. It's the monthly or annual fee you pay to be in the club, so to speak.
And in the U.S., under the Affordable Care Act, this isn't an arbitrary number.
No, it's calculated using 5 specific factors: your age, your geographic location, your tobacco use, whether you're enrolling as an individual or a family, and the overall plan category you choose: bronze, silver, gold, or platinum.
Okay, next up, the deductible. This is the first financial hurdle you face when you actually need to use your insurance.
It is. The deductible is the amount you, the insured, must pay entirely out of pocket before the insurer begins to pay its share for most covered services. It acts as a financial gatekeeper.
And the key actionable insight here, the thing people often miss,
Is that copayments generally do not apply against the deductible. That $45 you pay for a doctor's visit often doesn't help you chip away at that big deductible number.
got it. The smaller, more frequent cost, the copayment or copay.
This is a fixed, generally small amount, say $30 or $50 that you pay out of pocket every time you access a specific service, like visiting your primary care doctor, seeing a specialist, or filling a preferred prescription.
And you pay it regardless of whether you've met your deductible or not.
Correct. And related, but mathematically different, is coinsurance.
This one trips people up.
It does. Coinsurance is a percentage of the total cost that you pay, and it usually kicks in after your deductible has been met. For example, your plan might be 30-20. That means the insurance company pays 80% and you pay 20% until you hit your maximum.
And this is where high-cost surgeries or hospital stays can still require really large out-of-pocket payments, even after you've cleared that initial deductible.
Exactly. And finally, the ultimate safety net. The one number you absolutely must know for your plan: the out-of-pocket maximum.
This is the critical financial security mechanism.
It is the absolute cap. Once the combination of your deductible payments and your coinsurance payments, and sometimes your copays, it depends on the plan, once all that hits this maximum figure, your personal payment obligation ends for the benefit year.
And the insurer pays 100% of all further covered costs.
That's right. Knowing this number is the most actionable piece of information for budgeting for a major medical event.
Okay, beyond the costs, you also have to navigate the administrative system, which introduces immediate complexity, particularly around networks.
Yes. You need to know the difference between in-network versus out-of-network. In-network providers have signed contracts with your insurer to accept discounted pre-negotiated rates. This always results in the lowest cost for you, the patient.
And if you choose to go out of network,
The provider has no such agreement. The patient may have to pay the full undiscounted bill, which can be, well, staggering.
and the administrative hurdle that frustrates both patients and doctors alike, prior authorization.
Ugh, yes. Prior authorization is the insurer's way of controlling costs for expensive services. It's a certification that's required before a costly medical service, like an expensive MRI, a specific drug, or an elective surgery, can occur.
So if you get the authorization,
The insurer is contractually obligated to pay, assuming the service delivered matches what was authorized. But this is where the administrative nightmare starts, because a delay in authorization often means a delay in necessary care.
we also need to look at the formulary when it comes to prescriptions.
The formulary is the insurance plan's specific regulated list of drugs that it agrees to cover. This list is based on cost effectiveness, price negotiation, and the availability of therapeutic equivalents.
So if your doctor prescribes a drug that is not on your plan's formulary,
The cost often falls entirely on you, the patient, unless the doctor can successfully appeal based on a clear medical necessity.
and the document that arrives weeks after the service, the one that looks like a bill but isn't, is the explanation of benefits, or EOB.
Right. The EOB is not a bill, but it's the crucial document. It explains exactly what the provider charged, what the insurance deemed the allowed amount, what they paid, and how your patient responsibility was determined. It's your only way to audit what the insurer covered and how they calculated your share of the cost.
Now, zooming out for a second, the sources emphasize that all healthcare systems, regardless of whether they are taxpayer-funded or private, ultimately have to ration care in some way to avoid excessive spending.
They all do. They often use tools like cost effectiveness analysis or CEA to make decisions about which new services or drugs are worth the investment. And the sources logically point out that if a system sets a higher threshold for what it deems cost effective, the premiums for that coverage must necessarily increase.
It also found a link between competition and price.
A direct link. Low competition among health insurers was found to directly correlate with higher premiums, meaning choice is a key element in keeping things affordable.
All right, let's move to our final section, Section 6, the global comparison. We are synthesizing a massive amount of regulatory information here, so we'll focus on a few key systems that represent the clearest philosophical contrasts in how to manage medical risk.
And we have to begin with the United States, the complex hybrid system we've just spent time analyzing through the lens of private insurance mechanics.
The U.S. system, as we've said, relies heavily on private health insurance, covering approximately 69% of adults. But it's supported by a really robust set of public programs.
That's right. You have Medicare for seniors and the disabled, and Medicaid for low-income individuals and families.
Regulatory context is absolutely paramount in the U.S. The ACA, or the Affordable Care Act, was the seismic shift of the modern era. It required certain employers, what they call applicable large employers, to offer affordable minimum essential coverage, or face some pretty hefty financial penalties.
The ACA essentially restructured the entire private market to achieve two goals that had been politically difficult for decades. Guaranteed issue.
Meaning insurers cannot deny you coverage for pre-existing conditions.
And community rating, meaning they cannot charge you a higher premium just because you have those pre-existing conditions.
And the modern trend in the U.S. is the clear shift toward high-deductible health plans. This is the key insight for you, the listener. The system is actively shifting risk onto you.
It is. You get a lower monthly premium, which looks attractive, but the trade-off is that you are essentially self-insuring the first, say, $5,000 or even $10,000 of your medical costs each year. This consumer-driven healthcare model is offset by the ability to use a tax-advantaged health savings account, or HSA, to save for those costs.
Okay, now let's jump across the Atlantic to the United Kingdom, which operates on a completely different philosophical footing, the National Health Service, or NHS.
The NHS is funded directly from general taxation. It's so critical to understand that it's not an insurance system. There are no individual premiums, there are no patient-level charges for care at the point of service, and the costs are not prepaid from a specific risk pool.
The risk is spread through the national tax burden itself.
Exactly. Private coverage does exist, but it's used by less than 8% of the population, generally as a top-up for faster access to specialists or better amenities, like a private room. But these private plans often exclude the most costly categories, like long-term aging care, chronic conditions, or pre-existing conditions.
And this model does generate its own controversies, particularly around patient choice.
It does. The British Medical Association, for example, voiced concerns over insurance practices like open referral, where the insurer, rather than the patient or the primary care physician, determines which specialist consultant a patient sees, potentially prioritizing cost over the patient's preference.
Okay, moving to continental Europe, let's analyze Germany. This is the historical cornerstone of social health insurance.
Germany has the world's oldest national social health insurance system. It was established under Bismarck way back in 1883. Today, it operates as a mandatory two-tier system. About 85% of the population is covered by the mandatory statutory health insurance, SHI, which is known as GKV.
And the remainder, who are typically high-income earners or the self-employed, can opt for private insurance, or PKV. So what is the key difference in how they pay for it?
The contribution structure really reflects the solidarity model. SHI contributions are based on your income. It's a percentage of what you earn, regardless of your personal health status.
So a healthy CEO pays more than a sick retail worker.
Much more. PKV contributions, conversely, are based on the individual's age and health condition, just like traditional commercial insurance. This makes the German system highly sensitive to economic status while ensuring universal coverage for all.
And finally, let's look at the Netherlands, which has innovated to specifically solve a major insurance problem that plagues other systems: adverse selection.
Their system, which was redesigned in 2006, is really genius in its structure. It mandates that all adult residents must purchase a government-set minimum coverage from a private insurer of their choice.
But how do they prevent those insurers from simply avoiding sick people, which would be the rational financial move?
That's the innovation, the insurance equalization pool. Insurers receive funds from the central pool for every single person they insure. But the critical twist is that significantly more money is distributed from the pool for high-risk individuals, the sick or the elderly.
So the insurers are actually compensated, they're paid extra, to take on the most costly patients. It completely removes the financial disincentive to insure them.
Precisely. As a result, insurers cannot deny coverage for the basic plan. They cannot charge you more based on your health risk for that basic plan, and they cannot impose annual caps or deductibles on the basic package. It's a market-based approach, but with really robust regulation designed specifically to prevent adverse selection and ensure universal coverage stability.
What stands out so clearly across all these systems is the fundamental national choice. Whether you manage the cost of risk through general taxation like the UK, through income-based contributions like Germany, or through these highly regulated private markets like the US and the Netherlands. We have covered a huge amount of ground today. We've moved from the history of fringe benefits as a wartime regulatory workaround all the way through to how these vastly different global systems manage the national risk pool. Let's try to synthesize the core learning for you.
We established that employee benefits are this complex hybrid. On one hand, you have the mandatory safety nets like the foundational health coverage in Canada or the required pension contributions in the UK, which provide real security.
And on the other hand,
You have the purely discretionary perks, the local discounts, the in-kind meals, which are designed purely for loyalty and job satisfaction.
and the global differences are not accidental, they're deeply structural. The U.S. relies on an employer-driven, tax-sheltered private market that's subject to federal oversight like ERISA and the ACA.
Which contrasts so sharply with the tax-funded solidarity models of the UK and Germany, where your contribution is based on your income, not on your personal health risk.
We also saw that critical, actionable shift in the market toward localized, personalized perks. It's driven by the necessity of engaging remote and hybrid workforces, using these big platforms like Reward Gateway and Benefy to deliver custom value directly to the employee's own community.
But that growth in discretionary perks is constantly balanced against the sobering reality of the Perk-cession. We learned that these cultural amenities, those nice-to-haves, are often the very first things to be cut the moment financial hardship hits a company, resulting in swift and severe cultural damage.
This brings us to our final provocative thought for you to carry into your next compensation review.
The sources made it explicitly clear that companies use these discretionary perks to build retention and loyalty. Yet the moment the company needs to save money, those are the very first benefits to be cut. So if employee loyalty is being built on these highly unstable discretionary fringe benefits, what does that say about the stability of the modern employment contract?
It forces you to weigh the perceived value of satisfaction, that feeling you get from a perk against the guaranteed value of security, the mandated benefit. Which compensation component are you truly relying on to ground your economic life? And what does the volatility of the Perk-cession tell you about which benefits your employer truly considers non-negotiable?
It's a crucial question when you're analyzing your total compensation. Is your package designed to keep you happy, or is it designed to keep you secure?
That's a deep question for your next negotiation. Thank you for joining us on this deep dive.